Okay, so now we will look at the diseases of pericardium. Acute pericarditis is infection of pericardium or inflammation of pericardium caused by infectious pericarditis, means infection of viral or bacterial or tubercular or fungal causes of the pericardium can create the inflammation. Viral causes are Coxsackie virus or ecovirus, while bacterial and tubercular or fungal causes are also present. Post-MI pericarditis is also known as Dressler syndrome, can be the causative risk factor. Uremic pericarditis in patients who are in renal failure, post-radiotherapy, post-surgery patient, autoimmune patient, collagen vascular disease, and drug-induced pericarditis is also present, and the drugs will be procainamide, hydralazine, cyclophosphamide can also cause pericarditis or inflammation of pericardium. Now, the other causes are malignant pericarditis, which may be because of tumors, primary tumor, or metastatic pericarditis can be because of metastatic tumors of the breast cancer, lymphoma, or leukemia. And the clinical features of pericarditis will be chest pain, because pericardium and heart is present in the middle mediastinum, so chest pain will be there. Chest pain is pleuritic in nature, which will aggravate on deep breath. Chest pain is also positional, and which aggravates on lying supine. Coughing, deep inspiration, and relief by sitting up or leaning forward. So these are the chest pain types. And pericardial friction rub will be there. It is diagnosis of pericarditis usually heard in systole, and the friction between visceral and parietal pericardium will create a high-pitched superficial scratchy sound, and the pain will be present in the patient. So the diagnosis of pericarditis will be on basis of ECG. ECG will show wide ST elevation, and PR interval depression is a specific indicator. And the treatment for pericarditis is aspirin 600 milligrams 6 times daily, and SAIDs should be given, steroids, and for purulent pericarditis, antibiotics and pericardiocentesis is necessary. And in this way we can manage the patient of pericarditis. Other types of pericarditis are tuberculous pericarditis, in which we give anti-tubercular chemotherapy plus 3 month steroid course. So in this way we can manage pericarditis.